Hi, my name is Kenzie Ho, and this is my professional identity video reflection for Nursing 4840 with Auburn's BSN concurrent program. As I complete the RN to BSN program, I've spent a lot of time reflecting on how my professional identity has developed throughout my education, clinical experiences, and personal growth. In this video, I'll talk about how my identity has evolved, the values that guide my practice, the influence of nursing standards and ethics, my connection to 4 BSN program outcomes, and my future vision for my nursing career. Now, when I first entered the BSN program, I mainly viewed my identity as a nurse through the lens of clinical skills, being able to perform tasks safely and understand disease processes. But as I progressed through my ADN program with Southern Union and transitioned into the BSN curriculum here with Auburn and gained more real clinical experience, my perspective on this completely shifted. During my preceptorship on a neurostroke med-surg unit at Piedmont, I moved from being task-focused to someone who understands nursing as a holistic, patient-centered, and critically thoughtful profession. Managing a 6-to-1 patient load and giving and receiving report independently, collaborating with lab physicians and techs, and taking the lead on patients taught me the importance of organization, communication, and adaptability. Through the BSN coursework, I strengthened my leadership skills, evidence-based reasoning, professional communication, and understand the quality and safety aspects of patient care a little bit better. My identity evolved into someone who sees nursing not just as a career, but as a responsibility to advocate, prevent harm, and guide patients through very vulnerable moments in their lives. Now, my core values really fall around compassion, accountability, integrity, and commitment to a lifelong learning. And this guides my practice every single day. Compassion shapes how I care for neurologically impaired patients, anxious patients, and families who need support. Accountability shows through my safe medication practices, understanding rights, communication, documentation, and asking for help when needed if I'm not so confident in a skill or in what I may be doing. Integrity drives me to advocate ethically, follow standards, and do what is right, even if it's difficult, if it may not be the easiest thing. Lifelong learning motivates me to keep asking questions, seek mentorship, and pursue more advanced roles in the future. Now, these personal values align strongly with the heart of the nursing profession. We care holistically, we think critically, we act ethically, and continue throughout our careers. Professional standards have played a huge role in shaping my identity. The ANA Code of Ethics taught me the importance of advocacy and respect for human dignity and maintaining a safe practice. The Board of Nursing Standards reinforced my responsibility to stay within my scope of practice, communicate professionally, and uphold patient safety as a priority. Now, one of the greatest influences on my identity has been my preceptor, Hadley. She has been amazing throughout my preceptorship. She is an ADN nurse as well. She printed medication list every single shift, and we went through each one. She explained the pharmacology, the considerations, all the nursing considerations behind it, and real life scenarios that she had dealt with in results of these medications or pharmacology. Now, we've connected each of these patients' diagnosis to the physician's plans, identified nursing priorities for each shift, and these experiences tied ethical and professional standards directly into my day-to-day practice. Now, I connected these with 4 of the BSN curriculum outcomes and how I met them through clinical practice, coursework, and assignments. The first one that I connected with was the Apply Clinical Judgment with Person-Centered Care and Therapeutic Communication, domains 1 and 2, because on the neurostroke unit, I strengthened my ability to assess patients, identify priorities, and provide personalized, individualized care. Working with stroke patients, endocrine disorders, psych symptoms, and trauma cases helped me develop strong clinical reasoning. And I adapted my communication to meet the needs of confused, anxious, cognitively impaired patients, fulfilling this outcome through therapeutic interactions and patient-centered care. And I also saw that I used outcome 3, where it used scholarly and ethical approaches to apply evidence and improve care. Domain 4, My fall prevention quality improvement project directly contributed to this outcome. I reviewed evidence, analyzed fall rates data from 10 Main at Piedmont, and created a structured checklist, implemented staff education, and this project taught me how to integrate research with practice and use ethical reasoning to improve patient safety. I also used outcome 4, use information and communication technology to deliver safe quality care, domains 5 and 8. So throughout my clinical rotations and BSN coursework, I learned how to effectively use technology such as the electronic healthcare records, medication administration systems, barcode scanning, fall risk scoring tools, and communication formats like SBAR. Informatics courses showed me how technology supports safety, documentation accuracy, and quality improvement efforts as well. And now the final outcome that I experienced was engaging in interprofessional collaboration and communication, domain 6, outcome number 5. I experienced interprofessional collaboration daily in clinicals, communicating with physicians, PT, OT, respiratory therapy, lab, MRI, pharmacy, techs. I independently gave and received report using SBAR, which improved my confidence and clarity. The Friday night in the ER IPE simulation also strengthened my collaboration skills by showing how each discipline impacts patient flows and outcomes. Now, looking ahead, I'm very excited about my future in the nursing because I feel like I found the path that truly aligns with my interests and my strengths. And I've always had a passion for pediatrics, but throughout my clinical experiences, I've discovered how much I love cardiac nursing. The complexity, the critical thinking, the physiology involved. I really just love the heart in general. And I was recently offered a position at a cardiac med surg floor in Colorado. And I see this as a perfect foundation for where I want to go with my nursing career. This role will prepare me for higher acuity cardiac patients and environments, strengthening my rhythm interpretation, cardiac assessments, teamwork, and early recognition of deterioration. My long-term goal is to kind of transition into critical care, specifically the CVICU, and eventually move into pediatric cardiac nursing, hopefully, in a location that I love and thrive in. I love the mountains. That's kind of why we chose Colorado. I plan to pursue certifications such as like ACLS, PALS, and eventually CCRN or pediatric specialty certifications as well. I want to continue building my clinical judgment, leadership skills, and my confidence in caring for complex patients. And ultimately, I see myself becoming a nurse who is compassionate, knowledgeable, steady under pressure, and someone who advocates fiercely for their patients and uses evidence-based practice to deliver safe, high-quality care every time I come into work. I'm excited for the journey ahead and the opportunities to keep growing into the nurse that I'll always want to be. And thank you for watching my reflection, supporting my growth throughout the RN-BSN program. I'm grateful for everything that I've learned, and I'm very excited for what comes next. Thank you.